Dupuytens disease is a condition that's a genetic condition where the finger tends to develop what we call a contracture. It tends to draw into the palm of the hand. Now, there's many variations of this problem. In fact, some people can have Dupuytens disease that does not manifest with a bend in the finger. It just manifests with knots and nodules in the palmar aspect of the hand. They can also get it in different areas of the body, including the feet. It's not a malignancy, it's not a cancer, it's simply a thickening of what we call the fascia, which is a tissue just beneath the skin. And not everybody requires treatment for this problem. Only patients that have an associated contracture or a bent finger actually require a treatment. Now, I simply like to tell people of the tabletop test, which is a test that they can do at home. If they can lay down their hand flat on a table without the finger causing an impedance, then essentially they don't need surgery. Now, if they can't do that, then they will need something done about it to correct the contracture. Now, the bad news for the patients with Dupuytens is that the disease will be there for the rest of their lives. It's something that they die with. There's really no cure, given that it's a genetic problem. Now, I have recently moved from performing open palmar fasciectomy, is what we call it, to performing more of a minimally invasive approach to this called the needle aponeurotomy. Needle aponeurotomy is essentially using the bevel of a needle to rupture the cords, the Dupuytens cords. It's very gratifying for the patients because they literally come in with a bent finger and 5 to 10 minutes later they leave with a very straight finger. There's no incisions that are used. We don't make any cuts on the patient. And this is not a technique that we made up at the Florida Hand Center. This technique has been around for a long time, and it was originated in France because this problem is a genetic problem that comes from Europe. Patients after the procedure will use their hand right away and will not require pain medication.